Our project is operating in northeast of Afghanistan, in Takhar province. There are 4 districts targeted in this project. As breastfeeding is a main problem in our society, so this project is tackling, in fact, addressing these breastfeeding issues. So in fact, its main goal and objective is to promote early and exclusive breastfeeding and enable families to feed children age-appropriate feeding. Mainly in most intervention in nutrition projects, mothers are mostly targeted. What is innovative in our project is that in this project we addressed male involvement as main components, and we focus mainly on enabling environment which is comprised from involvement of male who are the husband of the wife, and as well as mother-in-law, and as well as other community decision maker who influence the breastfeeding practicing among the families. So this is one aspect of the project that is innovative, which is involvement of male, and at the community level it is that we created breastfeeding support group, which is also something new, although there is other community set up in the community, but specifically for this project this is something new as well. As we told that involvement of male in this project is one of its uniqueness of this project, and their involvement was very crucial in this project and was very important as well for us. Since in our community, which is a more conventional community, it's male dominant, so we tried to involve the male in this process at every stage of this project. So that's why we involve male in the breastfeeding support group members. They are part of this group. So in fact, this breastfeeding support group, which is at community level, they are comprised of male and female in a 50-50 level. So it means that male involvement is as much as equal to the female involvement. So it shows their commitment and their interest for solving their family problem, because it's breastfeeding is a family level problem, so each male want to have solution for this. So that's also one aspect of their interest to be involved in this project. Establishment of 400 breastfeeding support group in the village level. This is one of the main achievements of the project. At the health facility level, establishing of breastfeeding counseling corner or counseling center, which provide counseling about the breastfeeding to the mother and those who need that. So at each health facility we built one breastfeeding corner. So in total we had 4 breastfeeding corners. And at the same time, through this establishment of this corner, we could manage to provide consultation to 3,000 pregnant and lactating women through this project. So it was a big achievement for us to provide consultation for such big number of mothers. Through this consultation, we improve their knowledge and practice and attitudes regarding the optimal infant and young child feeding practices. In the beginning, when we started the project, the community interest was something challenging, because they were not interested. They say, "What are you saying?" Especially for male involvement, they said, "It's not our work, it's not our business, it's mainly women business that they should deal with." But as for us, we had discussion with them, we had repeated dialogues with them, we expressed them the advantages of this program. So after repeated discussion, they were convinced and they came to the program. And this was one of the challenges which we succeeded to overcome. Other was the insecurity in the area, because insecurity impaired our monitoring activity to the site. We were not able sometimes to monitor properly the project. So this was another challenge which happened more frequently. Other part is that follow-up of breastfeeding support group, this is something we initiated. We set up the breastfeeding support group. It was something new for us as well. So we did this, and in theory we thought it will be very practical, but in practice when we came to the field, we set up the breastfeeding support group. We felt that its monitoring is a bit difficult because we cannot go regularly there. There should be somebody to regularly monitor, to check, to supervise this breastfeeding support group. We were able, but not to the extent which we wanted. The other challenge was that there was no data system available to have a data of all the system to show the impact of the program at village level as well as at the health facility. This was something that we lacked this system, and we hope that in future projects it will be considered. And at the same time, the daily caseload for the breastfeeding counselor, because the breastfeeding counselor, she is a midwife, she is doing other jobs as well, and this is something extra to her work. This will increase his workload. So this is also something that the daily caseload of the breastfeeding counselor is something challenging. We were not able to determine how many patients they are seeing. This is something that we lack in this project. This project is, as we said, it's at a community level as well as at a health facility level. So at a health facility level, the health facility staff, they were the main stakeholder involved in this project because their commitment and their support was very important for us. One of our strengths in this project was that we ourselves are BPHS implementer, basic package of health service provider in the area. Since 10 years, 9 years, we are present there. So this extra work that we brought to this midwife, this is something that she was not willing to do so. But as for us, we had a very long linkage with those people. They know us, and we could convince them to have this project in their health facility. So their involvement was very important as well in this project. So they were main stakeholder in the head of health facility, the midwife. These two people were important. In the community itself, they were main stakeholder. They were very important. The breastfeeding support group member, they are mostly from community health worker, and plus extra staff from the community, the influential people, the mullah, teachers, some educated people, some uneducated people, whatever, they were willing to come. So they were main stakeholder in this project to us. We had advocacy for IYSF project as well as at the community level as well as at national level, because we presented this project in different forum at national level, so that now this project has been accepted as a nationwide. The Ministry of Public Health of Afghanistan want to scale up this project nationwide. So I think this is a very big achievement. And for scaling up of this project, I think this project is now very early ended and completed. But this project is still running in our program. It means that this project was a sustainable project. So it's already integrated into BPHS. That's one of the big success of this project, that without any extra cost, except the initial investment on the training and increasing awareness, nothing more is needed. So this is now the MOPH is willing to have it scale up in the whole country.
Okay, thank you very much.
Thank you. Thank you very much for me as well.